Welcome to Conversations on Healthcare. This week we look at healthcare on the ballot from two sides of the coin with Emily G. from the Progressive Center for American Progress and Joseph Antos from the Conservative American Enterprise Institute. Now, here are your hosts, Mark Masselli and Margaret Flinter.
Early voting has already started in some parts of the United States as Americans make important decisions about who they want to represent them. The polls show that health-related issues are some of the most important ones to voters this year. Joining us to discuss health care on the ballot are policy experts from two prominent Washington, D.C. think tanks.
Emily G., Ph.D., is the Vice President and Coordinator for Health Policy at the Center for American Progress. G has worked on the implementation of the Affordable Care Act, and she was an economist on the staff of the Council of Economic Advisors in the Obama White House. And Joseph Antos, Ph.D., is a senior fellow at the American Enterprise Institute. He served in high-level positions at the White House, for Congress, and at the agency level.
Well, welcome to both of you to Conversations on Healthcare. Well, let's start with Joe. The Republicans have released their policy agenda called Commitment to America, and it includes wording about personalized care and lowering prices through transparency, choice, and competition. But it's a bit vague on details, but it does. I'm wondering if it aligns with your thinking, and tell us why.
Well, I think those words align with my thinking. It's not surprising that Republicans for the midterm are not being very specific about health policy. Health policy really, I think for Republicans is really not high on their agenda right now. But the other factor, which I think is often overlooked, is that they don't want to get ahead of whoever their candidate's going to be in 2024. That said, yeah, the idea of promoting an efficient healthcare system, working off of the current system that we have today, which is a mixed public-private system with regulation, that makes a lot of sense. And to try to create those efficiencies, I think there are several key components. One clearly is that consumers, patients, and their doctors need to have a better idea about not only what things cost, but also how effective the treatments are likely to be, and whether there are alternatives. I think that's really critically important. We in Washington, we tend to focus on budgetary numbers, but what really matters is healthcare. And what people care about is, am I going to get the care I want at the time I need it? Will it be good care, and will I be able to afford it? I think those are the big issues.
Well, thank you for those comments, Joe. And Emily, let me turn to you. Your think tank has the word progress right in its name, and CAP is known for its progressive stance. As you say on your website, your mission is focused on improving the lives of all Americans through bold and progressive ideas, as well as strong leadership and action. So maybe tell us, where does CAP stand on health policy, and any points of difference from what we heard from Joe?
So I think when I think about health policy, and in particular health equity, it's more than just the healthcare system, and there are a variety of ways in which we try to approach this issue. One piece of health equity is, of course, the healthcare system itself. The Inflation Reduction Act, which passed back in August, will help achieve some is a big step toward those goals, helping decrease the cost of coverage for millions of Americans, giving seniors protection they didn't previously have against out-of-pocket costs for drugs and Medicare. But it also, that together with a couple of the other big pieces of legislation that passed in the last couple of years, the Infrastructure Investment and Jobs Act and the CHIPS bill, aren't necessarily health care bills per se, but they do advance health because they take care of what we call social determinants of health, or the factors that influence what goes into health. Part of achieving health is getting the health care that we need, having health coverage, but a large part of it is about the environment that we live in. Do you have access to clean water and clean food? Do you live in a safe neighborhood? And so in particular, the Inflation Reduction Act and the Infrastructure, the Investment and Jobs Act do affect our environment and help address climate change, making historic investments, not just in addressing climate change, but making sure that money goes to underserved communities. And so, our hope is with equitable distribution of the funding available in those bills, we can prevent situations like we just had in Jackson, Mississippi, where a predominantly Black community with very outdated water infrastructure didn't have access to clean water for 2 weeks. And that has knock-on effects to the ability of businesses to operate, the ability for kids to go to school. And so taking care of both our built and natural environment is really a key component for health.
Well, let's make sure we're clear on where each of you are in relation to the candidates in the ballot. So a question to both of you. Generally, would you agree Republican candidates are linked to AEI support for what it calls pro-market solutions to our nation's healthcare issues, and that the Democrats are aligned with the Center for American Progress view of a shared prosperity model? Joe, do you want to go first?
Sure. So, probably that's true. Although I can tell you personally that Republicans on the Hill don't necessarily take our advice, at least in detail. But I think the principles. I think there's a general understanding about market-oriented principles and the need to create incentives that lead to a more efficient healthcare system. But also, as Emily said, we need to make sure that it is a fair system. We need to make sure that people who need the help get the help.
For CAP, I would say, we are open to working with people, any and all political parties, but our vision for what healthcare system would look like is universal coverage. It's a place where everybody has access to healthcare, and everybody has the ability to achieve their full health potential, both because they have good healthcare, but also a good environment and good nutrition and good access to education. All the other things are so important for a good start in life. And I think, there are probably also areas where maybe Joe and I would agree if I could go on that limb. I do think there are places in healthcare where we do need better competition. One of them is among providers in healthcare, where, because of consolidation in the market for healthcare providers and insurers, consumers are often not getting a good deal on the price of healthcare. We pay 2 to 3 times more than other countries for prescription drugs. And we also have a system in which people with private insurance pay way more than the cost of care for some hospital services.
Certainly, healthcare and the whole country has had major impact from COVID over these last couple of years. We hope we're coming to the end. The Biden administration has extended the COVID public health emergency order for another 90 days. Emily, maybe let me ask you, you've supported this move. Maybe why? What does it provide for? And is it possible for this to continue when the president has said that COVID's over? How do we go forward with that?
So we are still dealing with the effects of the pandemic. I think we are entering a new phase in which, fortunately, even as cases are up and may rise into the winter, we're not seeing that same spike in hospitalizations, and that is because vaccines work. We have the new bivalent vaccines that give us protection not only against the original strains of the virus, but against the Omicron variants. The government has ordered more than 100 million doses of that. So there's plenty to go around. And I think getting that vaccination will be important for maintaining our nation's health going into the winter. But this continued preparedness and keeping up with the new variants will require sustained funding for public health, both for public health infrastructure to do the kinds of outreach and vaccination campaigns that we've had in the past, as well as to be prepared for new threats. So my hope is that Congress will provide funding for continued COVID readiness, as well as shoring up the public health system that has been so badly battered by the pandemic and has been underfunded for decades.
The Supreme Court's Dobbs decision overturned Roe v. Wade earlier this year, and Senator Lindsey Graham has introduced a proposed national ban that would prohibit abortion after 15 weeks nationwide, with only a few narrow exceptions. And the bill would allow states to ban abortion even more strictly. I'm wondering if you both agree that more limits to abortion will occur if Republicans take control of Congress and gain more power in state legislatures. Joe?
No. This is a very personal kind of an issue. I think both sides on this issue have tried to blow it up into public policy. This is a matter that is deep personal concern to the woman and potentially the rest of the family. I think this is not a topic that needs to be legislated on. It may well be the case that in some states they will clamp down a bit more in terms of the period of time over which abortion is permitted. That is apparently their right under the Constitution. I'm not a lawyer, I couldn't tell you. But I think this is a very sensitive issue that is not going to be something that at least Republicans will be talking about at the national level. The fact that Lindsey Graham introduced this proposal doesn't mean that Republicans will go for it. In fact, there's been largely silence from the Republican Party on this, and I think they are not willing to touch it at the national level.
Well, before Emily responds, though, Joe, if the Republicans take control of the Senate, is it that you don't believe, whether it will be up or down, that Graham won't be able to get it on the floor for a vote?
That's right. This is something that you can only people will not view any action in this area as uniformly favorable. And every politician wants to do things that are favored by their constituents rather than controversial among their constituents. And this is a controversy that is true in every state and in every congressional district.
Emily.
So my colleagues and I certainly believe, this is a deeply personal issue for women, and should be something that they choose and something that they are allowed to consult with their physicians on. It's also most people in America support, women in America support a right to choose, but that doesn't mean that legislatures won't go the other way. We've already seen some really draconian bans on abortion, preventing at the very early stages where women may not even know they are pregnant. And laws that don't have exceptions for cases like rape or incest or life of the mother. So I am very fearful of what could happen if conservatives take stronger control of state legislatures. Right after the Dobbs case, the Dobbs decision was handed down, we saw a handful of states enact so-called trigger bans or pre-existing bans on abortion, and they were very eager to put those into effect as soon as the court decision came down.
But Emily, we also saw Kansas, which I believe is a pretty conservative state, actually turn it down. What's your sense of it didn't seem to break on party lines there?
So I think that is that is hopefully part of a trend of voters either rejecting bans or hopefully adopting constitutional amendments that would protect women's right to abortion at the state level.
Well, I think we are all in for an interesting time watching the returns as the election arrives on our doorstep. But certainly a group of very engaged voters, usually our senior population, and certainly a population that we're all concerned about. And Joseph, I wonder if you'd comment, Bloomberg's reporting that House Republicans will enact Social Security and Medicare eligibility changes, maybe spending caps and safety net work requirements if they win the majority. I kind of had thought of those as that classic third rail that people wouldn't touch. These are such popular programs. Do you think that's likely? Should seniors be worried?
Well, let's distinguish between the programs. I think you've mixed a couple of programs up. No politician in his right mind or her right mind would announce that they're going to cut Social Security benefits. There may be a need to address Social Security funding. That's not the same thing as cutting the benefits. On Medicare, I think the same is absolutely true. And there's obviously a need, given that the Part A trust fund, Medicare trust fund that covers the cost of hospital services and other inpatient services, the Part A trust fund will become insolvent in the next few years, probably sooner than later, because the assumptions that went into that estimate were overly optimistic about how the economy is going. We're clearly in a recession. We're clearly in a high inflation time. These were not taken fully into account in the latest trustees report. So things are going to happen, are going to have to happen. But touching benefits is really very difficult for a politician. It's much easier to do what they've always done traditionally, which is to cut payments to providers and hope that that doesn't restrict access in any serious way. I think that's probably where it's going to be going. Now, what you did refer to, which I think is an issue for Republicans, has to do with the expansion of Medicaid eligibility and whether there is a social compact with people on Medicaid or on welfare programs in general. Do they have some obligation, if they are able to, and if the opportunity is given to them, to give back to the community? I think that's the question. That was certainly an issue during the last administration. I think it will be an issue in the future as well. The Biden administration has made it perfectly clear by reversing all of the approvals for states that wanted to try something different with their Medicaid programs over the past few years. They've reversed all of those waivers. So I'm sure that Republicans will be talking about this over the next 2 years, but that won't change the Biden administration's position on it. I think there is a legitimate question, given that we have similar requirements for social responsibility for welfare programs, that where a beneficiary in the Medicaid program is able and where the opportunity is available, the idea that there should be some social responsibility requirement, I think resonates very well with a lot of people, and certainly resonates very much with Republicans.
No, Emily, I wanted to sort of pick up on Joe's comments about benefits, because you've written about a lot about the Inflation Reduction Act, how it will save families thousands of dollars, including healthcare costs. But I'm wondering if it impacts the election, because getting to the insulin at $35 goes into January, past the election. Is this something that's really resonating right now? Are people connecting that these are on their way? And is it translating, do you think, into opportunities for Democrats? Or is it, show me, I'm from Missouri, show me it in my paycheck or in my Social Security benefits, but until then, I don't believe you.
I think these reforms will make a big difference. There are multiple components to the drug reforms that were in the Inflation Reduction Act. One is allowing Medicare to negotiate lower prices for drugs, which is a wildly popular proposal, now law, across not just Democrats, but Republicans and voters of all affiliations. And it also stops drug companies from hiking prices. The law will force drug companies to pay rebates back to the Medicare program if they raise their prices above the rate of inflation. But even less abstract, are these parts that will protect seniors from high out-of-pocket costs. And I do think, many people are eager to see those go into place, and they are, very tangible, very understandable benefits for people who have high drug costs. That $35 cap on out-of-pocket costs for insulin goes into place just 2.5 months from now. The $2,000 cap on drug spending in both Medicare Advantage and Part D standalone drug plans will take a couple more years to implement, but that too is something that seniors will, see, and I think it will be very real to American families.
Well, Emily, CAP recently published a report that stated that the federal public option would improve health equity across the United States. But Joseph, I think you've written that federal public option is unlikely to deliver the market transformation that some advocates predict. I wonder, Joe, could you explain your perspective? And then Emily, if we have time, we'd like you to comment as well.
Well, first of all, I don't believe that anybody's really talking about a federal public option. A number of states have attempted to create a so-called public option, Colorado being the first one that comes to mind. And the states that have tried to do this actually have been highly unsuccessful. I mean, in many people's minds, a public option is a health plan that's run by a government, state or federal, possibly. In the case of the states that have attempted this, none of them have taken on the task of having the state government run a health plan. They're not good at it, for one thing. Instead, their strategy has been to try to impose requirements on existing private health plans, and more importantly, a requirement on providers, especially hospitals, to participate in what are essentially discount plans, where the provider is required in some states to accept much lower payment rates than they typically get from commercial insurers. That hasn't worked out well for Colorado. That hasn't worked out for other states as well. The fact is that there is a public option already, in a sense, in the federal government. The ACA created it. It's called the exchange plans. And if you're eligible for it, then there's your public option. And the fact is that only about 6 million people in this country, 6 million citizens of this country, are not insured. Maybe it's about 8 million now. I'm not sure what the exact number is, but it's a relatively low number compared to the 350 million people we have in this country. And most of those people who aren't covered have options that they could pursue, and for some reason they haven't pursued them. Mm-hmm. So I think we're largely covered on this. I would argue that the ACA has largely solved the coverage problem. It did not solve the cost problem, but it solved the coverage problem, and 3 cheers for that.
So I will say that the exchanges are working. I mean, they were not designed to substitute for employer-sponsored insurance or supplant existing public programs. They were designed to fill a gap for people who didn't have either an employer or a public program option like Medicare and Medicaid. Prior to the ACA, people faced higher premiums if they had a pre-existing condition or for being a woman or for being older with no limit. And so what the exchanges were designed to do, or the ACA plans or Obamacare, whatever you like to call them, is fill that gap. And they've been very successful. It's actually 14.5 million people, a record high, who are enrolled in marketplace coverage this year. And the ACA marketplaces, in addition to Medicaid policy, have helped the U.S. weather the pandemic, even though there was a lot of, job loss, income loss during the pandemic. The uninsurance rate in the country held steady because those affordable options were available out there for coverage.
Emily G.
Can I make one other comment about the public option? If Democrats were to try to push through a federal public option, the first plans that would be hit by it would, of course, be the ACA exchange plans, unless, of course, the public option wasn't a better deal. So this is not a shrewd political idea, and it's not very good policy.
Emily G. with CAP and Joe Antos with AEI, thank you both for your insights. We look forward to your future writings and ideas. Thank you to our audience for being here, and you can learn more about Conversations on Healthcare and sign up for our emails updates at chcradio.com. Thank you both again.
Thank you.
Thank you.